what's nice about our conversation is that my experience has focused a lot on psychedelics and offering psychedelic-assisted therapy to patients, which I view as a catalyst for the therapy process. And you come from a more traditional therapy background. I'm wondering, if in your work you hit dead ends sometimes that you feel, might be sort of helped using, altered states of consciousness and experiences like that. Do you have any experience you can share?
Yes. So I'll share a bit of personal experience and a bit of clinical experience. And I think this is such an important question, whether you're a clinician or you're just somebody who's curious about these things, because I do think that's a question people often ask. It's like, when is it appropriate for me to explore this? Like, am I the right fit? And obviously, there's a lot of nuance there, but I will share for me how psychedelics have played a role in my healing. And then I'll talk about some clients here is, I had been doing various modalities for quite some time to work on traumas that I had from childhood, through teenage years, and was working really hard, was doing all the things I was supposed to be doing, and almost felt like there was an itch I couldn't scratch, like something I couldn't get to, that I had an inner sense or an inner knowing that there was more there, but no matter what, just couldn't quite get to. And that was the point where I began discussing, a different treatment approach in my mental health to help me access something that I hadn't been able to previously. And it was life-changing for me, absolutely life-changing. And I think between myself and the therapist I was working with, had I not trusted myself and had I not had a supportive person who trusted my own gut feelings about things, I maybe wouldn't have had that opening given to me. And I say that because this is something I've heard so frequently in my practice working with survivors, is like an inner knowing that there's more that you can't quite get to, or there's just a block of something that you can't quite get around. But if you don't trust yourself, you haven't done that work to really trust your body and your sensations and your feelings, that's a lot harder. And if you don't have a clinician who's open to, or at least somewhat knowledgeable about there being other options other than traditional therapies, even somatic therapies, outside of that, then you may not have that opportunity to go down that path. So I'm so grateful for that. With clients, where I've given referrals or had folks come to me even after they've done psychedelic assisted treatment, is similar situations where there was just a sense of there's something there that I can't quite get to. There have been folks who know exactly what their traumas are, but feel like there's emotional work that they just sort of get stuck in, and they're just kind of going through the same thing in traditional therapy. So that sense of stuckness. I think people who also are looking for almost that transcendental, transpersonal experience, where maybe they're also in the meaning making process or trying to move towards a meaning making process in healing their trauma. And, that psychedelic experience can give so much of that context beyond the self or meaning beyond the self, where, there's interconnectedness, there's intergenerational understanding. For some folks, it's very much just there's a huge component of spirituality that becomes part of that. But I think we have wonderful therapy modalities out there, and so many that do hit on some of the same around the edges, the experiences that you might get with psychedelics, like those transpersonal experiences, the kind of dissolution of the ego, right, where there's like non-identification with thoughts and experiences, and with internal family systems, for example, right, a self beyond your trauma. And I think sometimes those are experiences people have in their psychedelic treatment that they don't always realize that they're going to get, but are extremely, extremely powerful, and often come through such a faster process than therapy. And I would say that one of the biggest reasons, which ties into the other ones that I mentioned, is when you have developed such strong defenses and protector parts around your pain, your trauma, that, those parts are just working so hard for you that they won't let you past. And I think that's honestly the primary reason that I've seen people, or I have referred people, is we've done so much parts work, so much emotion regulation work, building up that safety and that even relationship with inner child and younger parts. But it's just like that psychedelic work takes it, like catapults it to the next level where there's just so much openness. And for others, it's the fear associated with revisiting those trauma memories which in some ways is one and the same as the protector parts, right? But if the fear around revisiting the trauma or the level of dysregulation is so great that we can't actually safely revisit those experiences, you get really stuck in the work. So I would say those are some of the primary reasons that I've referred or I see that people have benefited from, or what really brings them to that leg of the work.